Welcome back to Into the Deep with Father Theodore Guirguis. That's me. And we have with us David Guirguis. We have a very special episode. We're welcoming ourselves back after a long hiatus. And this episode actually is going to be all about where have we been and what we've been doing. So it's going to be probably an uncomfortable episode for David because he's going to get to talk about himself, which he doesn't usually like to do. But we're going to force it out of him because a lot of people have been asking. And actually, we really appreciate all the messages and the calls and emails. It's meant a lot to David. I'm sure he'll mention that. And it's meant a lot to me to see everybody praying for him and everything like that. So some positive and good updates for you all. And hopefully we'll get right back on track to recording and producing stuff on a regular basis. Welcome back, David.
Thanks. It's been a rough couple months,
But I think I'm happy to see that things are looking up and bright future for us, not just for the podcast, but for yourself.
Hopefully we're done with all this medical stuff. But
so, just to start, maybe, a million people asked me, and actually, even though I felt like I was there and I was with you at, at the hospital, and I was with you prior when other things were going on. But actually, I'm not a physician. So people would ask me hey, what's going on with David? And I didn't really have a good educated answer to say. I was I don't know, he's sick, something with his liver, pray for him. I don't really know. So you can, as much as you're willing to, give us a little bit update of what happened, or what did you have and what happened and how we got to kind of where we are now. Okay.
So it's kind of a multi-part story. So it starts back in California, back in 2021, maybe. The first thing that ever happened to me was actually I was getting blood work done, just normal checkup. And my doctor noticed that my platelet count was super high, almost a million, in the million range.
What's
and
it supposed to be?
It's supposed to be between 150 to 300,
okay.
1,000. So
okay.
I was 3 times, 4 times.
Sure.
And so she was oh, this must be a mistake. Go get more blood drawn. This had to have been a mistake. So I do it again, same number. And then she referred me
at
to
that point you're feeling fine.
Yeah. So I'm a healthy 26-year-old.
Yeah.
I'm, working out, whatever, everything's good. And so she referred me to a specialist. The specialist had some tests done and all this stuff. And it turned out I had a blood clotting disorder, which was not a big deal at the time. They weren't concerned with it. They were oh, if you don't have, this is what they told me. They said, if you don't have over 1 million in your platelet count, which I didn't, I was close. And if you haven't had a heart attack or a stroke, we can't really do anything. It's better to just
that's where they
leave
start to do something about it.
So after then it becomes serious and then we'll intervene. And I was okay, that's not very reassuring. And then a month later, I was working in Temecula, which is an hour and a half away from home. So I was out there and I was out eating with my friends, and all of a sudden I got this really sharp pain in my chest. And it was unbearable. It felt like acid reflux, but wouldn't go away. And so it was on a Wednesday, and then I went home that Thursday, and then I stayed home the whole weekend. And then Sunday night, I'm in pain, on the floor. My mom was you have to go to the hospital. And I'm no, I have to go back to work, whatever. And then we ended up going to the hospital. They did some blood work at the hospital, and they were you're fine. Nothing's wrong with you.
Wait, was this the time where they thought you were seeking drugs?
Because yeah, this was that.
I remember. I have to say a little bit of an aside of the story. They thought you were drug seeking and that you were some sort of addict.
That was after I had been admitted. They were giving me drugs, and then they were nothing's working. He's probably just faking it. I was what? It was bizarre. But they tried to send me home, and I wouldn't go home. I was no, I can't go home. I'm in a lot of pain. And so we knew a doctor that called the ER doctor, and he was listen, this is family friend, please take care of him, whatever. And then the doctor came to me. He's
they were going to let you, otherwise they were going to send you home.
Yeah, they were going to send me home. They didn't want to do anything.
Wow. I always fear these kind of things because for me, I don't advocate for for me, I'm oh, you told me to go home, I'll go home.
I've learned that you have to sit there and fight with them. They told me go home, and I said no. And then they came up after our friend called. They were do you want to do a CT scan? And I was this is I kind of backed down a little bit. I was if you think it will show something, I want to do it.
Yeah.
And the doctor was it won't show anything.
Yeah.
And I was can we just do it anyway? Please, let's just do it.
Yeah.
Did it. A couple hours later, they came back. They're we're admitting you to the hospital. And I was why? They're you have pancreatitis, which is extremely painful. So when your pancreas, I'm not sure exactly what happens.
Yeah.
your spleen is enlarged, you have a blood clot, and there's a spot on your liver.
Wow.
These 4 things were the nothing.
Showed up on the CT.
Yeah.
That was the nothing that
That
they were
was
going to
the
send you home
nothing.
with.
So they admitted me to the hospital. They didn't know what caused what in this like scheme of things.
All they know is that all these things are going wrong.
Right. And so the first course of action to cure pancreatitis is just don't eat and be on fluids for like a week.
Okay.
So they tried that.
Okay.
And the whole time I'm in pain, and so they're giving me pain medicine, and like that's the only thing that would stop the pain, but eventually your body gets used to it.
Yeah.
So instead of having it every 4 hours, now you need it every 3, every 2.
Sure.
Higher doses and all that. And eventually they got to the point where they're like, he needs to leave here and go to a rehab center. Because,
drug rehab.
Yeah, drug rehab, because he's
addicted now.
He's addicted now. And I was like, well, what? I'm just here. And so I spent 2 weeks in that hospital. And
wait, they said that to you after they even saw the CT scan that had all those problems?
This is after they didn't do anything. They didn't operate. They didn't fix anything. And they were like, he's just drug seeking. And I was like, okay. And then, so then what happened is that was 2 weeks in that hospital. They didn't do anything. They tried stuff and it didn't work. They they did an endoscopy or something that they did. And eventually they were like, we know this isn't going to do anything, but we're going to do it anyway. This is the words from the doctor. And so then my parents got fed up and they're like, you know what? We're going to sign an AMA and we're going to leave. We're going to go to UCLA, a much better hospital. So they did that, and I'm in the car. It's like 2-hour drive, and I'm in pain the whole time. And now I don't have any pain medicine.
Yeah, so you're irritable and you hate your life right now.
And so they were trying to transfer me there from a couple of days prior. So they had all my records and everything, but they just didn't have a bed. So when we got there and they saw, I was like drenched in sweat, like crying in pain. And they were like, okay, we'll admit him. And then they took me in. And then they actually were the ones that cured it. They did this like tube in my neck that was dripping dripping medicine into the blood clot directly, that broke it up. And so all this after 2 weeks there as well. So I was 30 days in the hospital now. I lost like 50 pounds.
Yeah.
I wasn't able to eat or drink anything the whole time. Finally they figured it all out. And then like everything
and this is
was
when
normal.
you were engaged, right?
This was before I was engaged.
Oh, okay.
But Sarah was there the whole time.
Yeah.
She
I remember she visited you while she was actually spent a lot of time with you in the hospital. Yeah.
So I remember texting her and I was like, when I first got there, I was like, hey, just want to let you know I'm going to the hospital. It's probably nothing. I just want to let you know. And then it turned into this whole fiasco. But so that was the first kind of section of things that happened was the blood clot. The spot on my liver ended up being just discoloration, and then they just let it go. And then the pancreatitis got better, and my spleen has always been enlarged. It's just that's how it is. And so I thought that was it. And then they put me on blood thinners and everything. And then turns out I reclotted in the same area. So they went in and did the surgery again and broke it up. And so I've been in and out of the hospital at UCLA a couple times just to deal with the blood clotting stuff. Yeah.
Okay.
And then I proposed to Sarah, and then I moved to Tennessee. And I remember one of the reassuring things was my hematologist, my blood doctor. His 2 choices of schools were UCLA or Vanderbilt.
Yeah, I remember you telling me that. So it made you feel good.
Yeah, he told me he's like, Vanderbilt's one of the best, so he felt safe sending me, like me going there. So then I come to Vanderbilt, and then turns out I had another blood clot at Vanderbilt. So then they fixed that. They put the tips in, which is like a little like stent that opens up the blood vessel that connects to the liver.
You were having all this clotting around the liver.
Yeah. And then, so then when I was doing follow-up imaging for the stent, which is just like, they wanted to see if the stent was open and the flow was good. They're like, hey, we found a spot on your liver.
Yeah.
And they were so unconcerned with it. They were like, it's probably nothing.
I think this is going to be a common theme in this story, that the 1% thing that could go wrong, unfortunately does.
Yeah. They were so like, if you scanned the whole population, 70% of them will have a spot on their liver.
This is no big deal, whatever, it's fine.
I was like, okay, sure. And then a couple months later, they're like, we're going to scan it again just to make sure.
Yeah.
A couple months later, they scanned it again, and it grew a little bit. And they're like, this happens. Sometimes even the benign spots will grow, but it's nothing to be concerned. It doesn't look cancerous. This is the thing they kept saying. And that was in January of like 2023, I think. Then it got to the point where it kept growing to where they're like, look, it's continuing to grow. We still don't think it's cancer, but out of due diligence, like if you want it removed, we can remove it.
Okay.
And I was like, okay, let's go ahead and remove it. Why not?
Yeah.
And so they biopsied it a couple times and it came out inconclusive every time they did it.
That's right. It was always like,
yeah, it was
not
always,
yes, not no.
Yeah, it was always like, could be, but probably not. And then they ended up taking it out, which was surgery I did in like June of 2023.
And all those things so far went, relatively according to plan and like,
I guess, yeah. I mean, that the first sign of something not going according to plan was that surgery.
Okay.
Because I had to go back into the ER because I was bleeding internally.
Yes, actually, I remember that now that you say that. I remember that. That's what made me ask, because I feel like I remember even you had an initial surgery that you did, and then something happened that they had to go back in.
That was pretty funny because Sharif was there when he was doing his rotation, and he was in the room when after the surgery, when I was trying to recover after the first part of the surgery, when they had removed it. And I told him, I was like, I feel really bad. Like something is like, I feel like I need to throw up. And he's like, oh, it's probably just, he was trying to comfort me. And then I got up out of my bed and I was like, go get me a trash can. And he looked so confused and he grabbed the trash can and I just started vomiting. And then they came back, they did a scan. They're like, oh, he's bleeding internally.
Yeah.
Rush back to the OR, fix it, whatever.
Yeah.
So that's the first hiccup along this whole road. And then I remember a week later, they were able to test the whole tumor that they took out.
Yeah.
And it came back as cancer.
Okay.
And so that was
for sure, definitively.
Yeah, it was like, this is cancer. The thing we took out of you was cancer, but now it's gone. Like,
so we're fine.
We're fine. So I was like, did I have it? Like, I don't understand where I am in this scheme of,
Yeah.
But they were like, it's gone. And there's no sign of it now. So
and it didn't spread. They didn't think it spread.
Didn't spread anywhere. So we're good. We got it and it's out. Yes, it was cancer, but it's good.
Yeah.
But it turns out I had another liver disease called NRH, which is like a super rare. It's called nodular regenerative hyperplasia. It's very, very rare.
Okay.
And I think it was caused by the first clot.
Okay.
Because I guess they're related somehow. Either one can cause the other or vice versa.
Sure.
So that causes spots to show up on the liver that look like tumors, but they're just like little spots pretty much.
Okay.
That's what the disease is. And they kept saying I had like a cirrhotic liver. So but I didn't have cirrhosis. So my liver was just not working right. So after all that, after they took the tumor out and then they were still seeing that I had a diseased liver.
Yeah.
They were like, the only real thing to fix this is a liver transplant.
Because you're always going to have these nodules and they're eventually going to cause you to have your liver to not work well. And
yeah, basically my liver is just deteriorating at this. Eventually it will stop working.
But on a day-to-day basis, and I think I know the answer to this because I see you, but on the day-to-day basis, how are you feeling?
I felt like everything that was wrong was just part of being a human. Like I was like always tired, always lethargic, but I was like,
I'm just
I
tired.
probably just don't sleep enough and I'm eating unhealthy or whatever. So it didn't like prohibit me from doing anything.
Yeah.
I just felt like not the best
at
times. And so then I got put on the liver transplant list and we waited a long, they were like, oh, it'll happen in 3 months. I was 6 months. And then they're like, actually probably closer to a year. So I just stopped really like thinking about it. And then I would always talk about, I would start looking things up, like what's the average recovery of liver transplants and how do they go and success rate, failure rate, and all this stuff. And I remember thinking it was going to be so easy. I was like, that's just a liver transplant. Like,
and you're young and you're relatively healthy.
Your age is going to be such a superpower for you. You're going to heal and all this stuff. And I was like, okay, cool. So then fast forward to April 29th. Then I get a call. I was up late for some reason. I remember we tried to sleep early that day and I just couldn't sleep. So I was like up on my phone and all of a sudden I get a call from Vanderbilt at like 1 a.m. And I was like, why is Vanderbilt calling? They call me all the time for stuff. Go get your blood work or whatever. Yeah. And I was like, why are they calling me at 1 a.m.? So I answer. And then the lady's like, oh, this is blah, blah, blah from the transplant clinic. Like, can I speak to David? I was like, yeah, this is him. And she's like, we have a liver match for you.
I remember you telling me you had very short, like you have to go in within, like 4 hours of being.
They said if you can get to Vanderbilt within, or like how close are you to Vanderbilt? I was like 20, 30 minutes away. She's like, if you can get here within the next hour, like that would be great. And I was like, okay. So we packed up and
I remember waking up. I didn't get the text. I was asleep, but I waking up to a text. Like, I'm going to the hospital. I got a liver.
Yeah, I was like frantically writing down what the lady was saying. She's like, park here, go here. And I didn't listen to anything. I just,
And mostly you probably were happy, excited. Like this is going to be like
yeah, I was like, finally.
the end of a long road of, yeah.
I was like, after a year, it was almost a year exact. It was like 1 week shy of a year was it how long we were waiting. And I was so excited. I was like, okay, finally, like it's going to be like, I'm going to get better, you know?
Yeah.
And in my head, I was like, it's going to be so easy. I'll be fine. So then we get to Vanderbilt and I'm like, I'm like, who do I need to tell about this? Because like, obviously my parents and my friends and, I didn't really know who my boss. I was like, I'm coming to work tomorrow. And so then I remember getting everything from like here on out is kind of a blur. Like a lot of everything that happened from when I got to the hospital till now, people have to tell me happened.
Sure.
So I remember going in and they're doing like, it took forever. Like we got there at maybe 2 a.m. and then we didn't see a doctor till 6 a.m. And then I was like, why did they need me to come in so quickly? They do all their tests, the blood work and everything. They had to like reduce my blood thinners because
you're about to do a surgery.
Yeah. So they had to like counteract it. And there was like a whole process for it. And then I remember like getting gowned up to go to surgery and Sarah's like documenting the whole thing. Like,
I remember. Yes, I remember that.
And the last thing I remember was being wheeled off into wherever the OR is.
Yeah.
And then from there, it was just blank. This is nothing until like May, probably like 12th or something.
Yeah, good
like
2 weeks.
2 weeks, I think. Yeah. And when I woke up, I was very out of it. Like people were talking to me and I couldn't register what they were saying. I couldn't talk.
Oh yes, I remember that. Yeah. Wow, I had forgotten about that.
I guess the intubation that they did was like messed with my throat.
Yeah.
So I couldn't speak at all, and people couldn't understand me, and it was just a mess. And I remember waking up and everyone was freaking out. They were like, 2 livers. I was like, what? I was like, what do you mean 2 livers?
Actually, I remember thinking, man, when this guy wakes up, he's in for a story because he has no idea what's going on.
I was so confused. I was like, I don't know why everyone's freaking this. I was like, why is everyone making such a big deal of this? Oh, this is a miracle. Within 24 hours, I was like, what happened?
Yeah.
And so it turns out that the liver that I got on April 29th went terrible.
Yeah.
Like the whole
But it was a good liver.
It was a good liver.
It was a good, healthy liver from a young person, I think, if I remember correctly.
It was like the perfect liver for me.
Yeah.
But the prep to get me ready for the liver went terrible.
Yeah.
I
think the clotting things had maybe some issues. You were bleeding and...
Yeah, it was like they said every time they went to like touch something, I would just start bleeding right there. And I was like, okay. And then they said my portal vein, which is one of the main connections
to your liver, yeah.
They said every time they tried to touch it, it would just disintegrate in their hand and it would just like go away. Because I guess where they put the stent was so far like out of where they thought it would be.
A long time ago.
Yeah. Okay. So they put it super deep in the portal vein, which means that everything prior to it was useless or something like that.
Okay.
And they were thinking like, why would they put it so deep? And I'm sure when they put it in, they were like, yeah, he's not going to need a liver transplant. Why would we even worry about that? So then they had to like take part of the donor's portal vein and try to use it, and it didn't work. And there was this whole mess of things. And so apparently, from what I'm told, I almost died.
Yes, you did. Yes, you did.
In that surgery.
That surgery was, I want to say it was a good 10, 12 hours. It was. I remember the day where they said, like Sarah was like, okay, he's going in and then we went to the hospital, and when they actually finally came out, it was an entire day. Yeah.
And so the doctor that was doing the surgery, he's a great liver transplant doctor. He's been doing it for over like 35 years, and he over, I think, like 10,000 transplants or some crazy number.
Yeah.
And
he happened to be Orthodox.
Huh?
He was Orthodox.
He's I remember, I think he was Indian Orthodox. And he apparently, he told me this. He said he stepped out of the OR in hour 9 of the surgery, and called his wife and was like, please pray for my patient David. I don't think he's like, we're losing him. He's not doing too well. And anyway, they found a way to basically reconfigure my anatomy so that like my renal vein was like the main artery or vein that they use to get blood to my liver. I'm not exactly sure all the specifics on it, but it was some sort of like crazy thing that they did. And then they closed me up from the first surgery, which took, apparently they do it in sections. So like I was still open for a couple days.
Yes. Yeah. They finished. I remember after that big 12 hours, they were like, okay, we got the liver in.
Yeah.
And we're not going to close him up yet because he's, swollen and whatever. We're going to let everything kind of relax. And then we're going to go in and close him up. Or, well, actually, no, they were going to go in and finish something.
Yeah.
I think they had to finish something. And then they were going to close you up.
Yeah. So they closed me up. I think it was second or third day after they did whatever they needed to finish.
Yes. I think it was maybe third day. Yeah. I remember that.
And then it was like a matter of just like waiting and seeing what happens.
Yeah.
And
all this time you're out.
I'm out. I have no idea what's going on.
Yeah. Yeah. This is people telling you what happened.
Yeah. Something was happening from my perspective, but it was completely different than what was happening in real life.
The real world.
Yeah. So turns out that they ended up saying that the liver wasn't working. Like they did a scan and they said that 80% of the liver was already dead.
The new liver.
The new one that they just put in. And so then they were like, this liver is now killing him. Like he's not doing well. I think I was like sepsis or something.
Well, I remember that actually you started kind of turning a little bit yellow. Your enzymes, all the numbers were going in kind of the wrong way.
Everything was going bad. And so the doctor who did the first transplant met with his boss, which is like the head of all liver transplants. And they were discussing what to do next. It's like, do we wait and see what happens, or do we do another liver transplant? And the doctor who did the first transplant said, I don't think he can handle another transplant. Like, just from what he saw, which is probably,
especially about how every single complication that happened, in the first surgery, he's probably anticipating something similar.
Yeah. So he said, I don't think he can handle another one. And his boss said, like they were arguing about it pretty much, and they said no, he needs another liver. Like this one won't work.
It's not gonna work. Yeah.
And of course, like trying to get my parents' approval and Sarah's approval, and like getting them on board.
I remember that because it's a decision of like, well, should we do that? Should we not? He barely made it through this surgery.
Especially when the doctor that did it's like, I don't think he can handle it.
Yeah.
At that point, it's like, and so they put me back on the transplant list on May 5th.
I remember that. I happened to be with Sarah the day that the liver doctor came, and he's like, we're going to put him back on the list. And I actually asked, I was just like, it took us a year to get this liver. Like, what are the odds? Like, he seems to be deteriorating pretty fast, you know? And he's like, no, this is going to be like a super special exclusive list. And it's like 13 states, and anybody within 500 miles that qualifies, it should be within 24 to 48 hours. So.
Yeah, I think I was the highest priority on, like, I remember when I got the first liver, it was like, they go off MELD score. So I was the highest score at that time, which was like, it's from 6 to 40. Yeah. And I think I was at like 30 something, like 31. And so then when they relisted me, I was at the high. Yeah, they were like, the next liver that comes available is his. Like, there's no other option. And so apparently we got 3 liver offers within 24 hours.
Yeah.
So they were able to pick which one they wanted and which one was the best and all this. And the second surgery that they did went a lot smoother in terms of time, like, because all the work had been done.
And I remember Dr. Guirguis, he was saying, like, now I'm intimately familiar with this man's anatomy. So like, I know exactly how it looks.
Yeah. And so then the second surgery took 4 hours. Yeah. And it was Dr. G's boss that did it. So he was there, but it was, I think that
it's kind of all hands on deck.
Yeah. He didn't want him to like, I'm not really sure, but it was a much smoother surgery. And then apparently this liver also, there was like signs that it was killing me, but like the blood flow was bad. They said.
I do remember that.
And then it turns out that the gauze that they put was just like
too tight.
Yeah. So then they removed the gauze, and then everything was working smoothly. And then that's when, next thing I remember, I woke up. So then, there's like video of me still being out, but responding to people. Like,
I remember in between the first liver and the second liver, like, and they're discussing your case and they're talking about things. And like Sarah would be like, we have to leave the room. And I'm like, why do we have to leave the room? And she's like, well, we can't, the doctors don't want us talking about David in front of David because David could hear us. And I'm like, David could hear us? I don't think he's hearing anything.
It was so weird. Like I woke up and I told him, I was like, I had dreams of this, this, and this. And it was,
you came to me like maybe 2-3 weeks after and you're like, did Sayyidina visit? And I was like, yeah, I brought Sayyidina and he visited, and he's like, because I thought I dreamed that. And I was like, I dreamt that. And I was like, no, he came. He didn't stay very long, but he came, prayed for you and he left. He's like, oh, I could have sworn I dreamt it.
It was bizarre. Like trying to separate like what happened versus what I dreamed about or hallucinated or whatever. Like the crossover between them is so weird and so
How
blurry.
much time did it feel like for you from I went down for surgery on April 29th till I woke up, May 12th?
So now it felt very fast. But at the time, like during when I woke up, everything felt like it was taking years. Like every day that passed felt like a year. And it was just like so I've been under anesthesia a lot of times, like unfortunately. But every time I've been under anesthesia before, it was very short, like endoscopy or whatever. And whenever those things happened, it's almost like instantaneous. Like you close your eyes, you go down.
I mean, I remember getting my wisdom teeth taken out,
right.
And that's not full anesthesia, but like you kind of you go to sleep and it's like, oh, next thing you know, you're awake.
Right. And so it feels like no time has passed. Like it felt like, wow, that was so quick.
Yeah, like a nap or something.
Yeah, this time was not the case. Like this specific time when I was out for the 2 weeks, felt like forever because I was like actively dreaming, and I don't think I've ever dreamt when I've been put under, but this time I did.
I remember you had very vivid like dreams.
I had the most bizarre things happen, but they were all like time is passing, and like the most vivid thing I remember was trying to wake up from the dream. Like I was trying to actively wake myself up and I couldn't do it. Like I was just stuck there. And it's weird looking back at it now, like how much time.
What were some of the dreams or the things that were happening while you were like that you felt like you remembered?
Okay, so the first like hallucination or dream that I had was is just kind of weird. So just bear with me. I think I was like watching a basketball game and I was like sitting in the stands and we were floating. It was like watching a game from the sky type of thing. And then for some reason the game went away and it's just the two stands looking at each other, and there was a thing in the stands across from me that was like taunting me. It was like wanted to fight, and I was like, what is going on? And it was like a spider, it was like some sort of like faceless thing that was like very scary looking in my dream.
Yeah.
And from what I think it is, I think it was the devil, because it started to mock me, and I remember like arguing with it, whatever it was, and I was telling it like, oh, I'm not scared of you, like I know that I'm dreaming.
Yeah.
I know that the second that I feel pain, I'll wake up.
Yeah.
And like God is with me. I'm not scared of you at all. And then the thing shot me. Like it pulled out a gun and shot me. And I remember feeling pain. It was so weird. And then I wouldn't wake up. And then I got really scared because I was like,
oh, I was supposed to wake up.
I was like, why am I not waking? Now I'm stuck here, and this thing is attacking me, and I can't wake up. And I was scared. And then it started mocking me, and it was like, what happened? You were so tough 5 minutes ago, and like, where's God now? Is not, not waking you up. That's for sure. And then I spent the next like portion of my hallucinations running away from this thing, and I was terrified the whole time. And so my dad thinks that this was the first thing that I hallucinated.
Yeah.
He thinks it lines up timeline wise with the first surgery.
Oh, okay.
And that everything was going wrong and I was dying, and so he thinks that there's some connection there. And so that was terrifying. And I remember even like after waking up, I couldn't sleep for days after I woke up, to the point where the doctors were like, you need to sleep or else you're going to start losing your mind. Like it was like 4 or 5 days after anesthesia that I hadn't slept at all.
Yeah.
And I did start like going a little crazy.
Yeah.
But then I had some other hallucinations that were I think after the second surgery that were, because I remember I would wake up, I would be awake, and then I had to go under for something else, or they had to go fix something else. And so I would have hallucinations then too. And those were good hallucinations. Those were like the complete opposite of the devil hallucinations. And I think it's because at the time I was really like how scared I was waking up, like was counteracted with like, what can I like listening to this beha or anything that would calm that down. And so I started thinking of really good things. And then I saw a couple of hallucinations that I think were, I know for sure one was Pope Krolos, because I remember the video that we made for,
Yes.
for, I don't know what it was, but we made a video and you talked about him. And I remember watching that video and there was a scene, like a clip of him walking in the desert.
Oh, yeah.
And that stayed in my head to the point where it, like, I was there in my hallucination following him. Like I was trying to find him. And basically I spent the whole time chasing him. And then he went to this like this monastery in the desert and I followed him and I was asking him for help. And like he talked to me for a little bit and was telling me like, I was asking like, please, I'm dying. Like I need help. And he's like, don't worry, it's okay. And he gave me a hug. And I remember it was like the most comforting time in the whole process of this craziness. And so after all of that, now we go to when I'm awake. Because when I'm awake, I start to like remember things. I was on dialysis, this machine that looked like an ice cream machine.
Yeah, I remember.
I was so convinced.
They had to convince.
They put a little note on it.
I saw that. I remember
not an ice cream machine. I was like, oh. But the other thing is I didn't know where I was, which was really scary. Like they kept asking, every morning they would ask me like, where are you? And then eventually I learned to cheat and they wrote it on the paper. So you are at Vanderbilt.
You didn't know?
I didn't know. Every time they would ask me, I would be like, it was just like nothing.
Where'd you think? Or you just had no
There
clue?
was a time where I thought I was at Disneyland. And I'm pretty sure it's because someone talked about Disneyland when I was under.
See, that's why they were saying like, you can't talk in front of them.
It was weird, but so they would ask me all these questions and I couldn't answer them. They're like the stereotypical questions that
what date, what's your birthday, who you are, like
not easier than that. Like, do fish swim in the water or swim in the ocean?
They're checking for maybe brain damage, brain activity.
And I remember it was the hardest thing for me to like.
They were worried actually. They for a long time they weren't positive. Like, oh, was there some brain damage that happened because of what was going on?
Yeah, it was the one that I never got was, do rocks float? And I was like sitting there and I was like, I've definitely seen rocks float. I don't know what. And so I would answer like that and they would get scared. They were like, but then there was just a lot of, I had a lot of tubes hooked up to me and like a NG tube and it was very uncomfortable and I was always in pain and I couldn't talk.
Yeah.
And it was very frustrating trying to get people to like understand what I was wanting or trying to say because they would try to guess. And I would get so angry that they're so off that I would just stop talking.
I remember that was a very frustrating time. I remember that.
Yeah.
I remember that.
And then that was pretty much it. It was a lot harder than I thought it was going to be.
I think one of the things, like just from the outside looking in, is like you go in, a relatively healthy, 30-year-old, everything is like pretty normal, like whatever. But but then, when you're out, it's like the complete opposite. So it's big. I remember having discussions with you. It was like, should I have had this surgery? Should I have done this at all? And that was a tough pill to swallow, I think.
Yeah, I still, even now, am not 100% sure that it was worth everything that happened. Just because, like, I'm nowhere near normal now. Like, I still am very weak and I don't eat. And, like, it's a lot of hard things to do. Like, I can't do anything that I want to do, pretty much. But, like, it's weird. So before I was so okay with everything, right? Like,
you were,
because nothing was prohibiting me from doing what I needed to do.
You were still living your life the way that you want to live your life.
Right. So everything that happened was just like a statement. It never really
it's like a number on a chart of a test, or like, there's a nodule, but it's like, I still feel the same. I'm acting the same. Everything's the same.
Yeah. So it's very easy to be at peace with things when they aren't impacting you.
I always remembered you being, it was actually like strangely calm. Actually, it was like, oh, you should be more worried about about this than you are.
Yeah, it's like I was so okay with everything.
Yeah.
And then when I remember there were a lot of like I tried to keep that same mindset when I was in the hospital, and I just couldn't do it. Like
Yeah.
I was getting like now here I am bedridden. I couldn't even stand up. I couldn't walk. I was like, I hate this. Like
Yeah.
I am not okay with this.
Well, actually, maybe you can explain a little bit. How long from, the day you woke up till the day you were able, for example, to take your first step?
So it was probably I'd say 2 weeks before I could even shift myself out of bed, like just to get to the edge of the bed.
Mm.
And I remember I had this huge problem of like fluid leaking out of my abdomen.
Yeah.
And every time I would stand up, it would just be like a puddle of whatever the fluid it is. And it made me not want to stand. Like every time they were like, okay, we're going to try and stand up, I'll be like, no, I don't want to. Like I'm just going to leak everywhere. I don't want to do that. But like it's a part of whatever your recovery. And I ended up putting like a vacuum on my stomach that like was supposed to like suck all the fluid out, and it would fill up in like 30 seconds or something. I was like, this is pointless. And so I had to use a walker for a very long time for like from getting up. And mind you, like this whole time I can't go to the bathroom by myself or like it was very frustrating. Like
like you're helpless essentially.
I basically like if I wanted to move my positioning, I had to call someone to like be like, hey, can you just pull this sheet or whatever. Yeah. And so I can't sleep on my back. I never have been able to sleep on my back, and that's the only position I could be in
that was comfortable.
That was
allowed.
That was allowed. Like I would be like, can I try to, be on my side? They're like, no, I have like things coming out of me or whatever. So that was another reason I couldn't sleep. But yeah, it was probably 2 weeks after I woke up that I could take my first steps. And then I was in the hospital from April 29th until June 10th. So it was a good amount of time.
Yeah.
And
that's like your 40 days,
Yeah, I missed all of the holy 50 days. That's but yeah, so that I think I learned a pretty valuable lesson of like I'm probably not as okay with things as I think I am until.
What do you mean? Because actually, I agree. Like, I think you were like very, very positive, but I think, post-operatively, there were some times where you're like, you're pretty mad at life, pretty mad at God, pretty mad at everything, actually.
Yeah, I kept on like thinking it wasn't fair. I was like, I get that. Like, there was a time when I was like, this is like I'm being punished for something. There's no way that this is all. And mind you, okay, I have to preface by saying that along every step of the whatever amount of days I was in the hospital, for sure, like God was there. Like I people will be like, oh, it's a coincidence. Oh, this is no. I know for a fact.
I was comforted when the surgeon came out and he goes, "Hey, are you Father Theodore? We pray at your church." And he showed me a picture of him at our church, and I was like, oh, okay. And his name actually means George, and your last name is Guirguis, and it was actually St. George's feast right around the time of the surgery. So
the amount of things that like lined up, or not even just like coincidentally, but just like things that I would pray for personally, like the NG tube was one of the most uncomfortable things because that's how they would feed me.
I remember that day.
and I remember I was like, okay, like every time I would just ask for like one thing, like just take the NG tube away and like I'll be happier, like I'll be better, I promise. And so then the surgeon came in and everyone was like, no, he still needs it. And the surgeon was like, the guy has been here for whatever amount of days, and he just took a scissors and cut it, took it out.
I remember being outside the room at that minute, and the nurses outside were like, "I think the surgeon just yanked the NG tube out of the guy."
They were concerned. They were like, "He shouldn't have done that," and he was like, "No, it's okay. You don't need it anymore." And so that was the case for everything that happened. Like I would ask to like after a week, I'll be like, "I really need to sleep," like or I really need to go to they're like, if you don't go to the bathroom, like we're going to have to do some I've been down this road before where they like have to put a catheter, and
Yeah.
I was like, no, I would rather whatever punishment, like I'll take it. And so like I remember like praying about little things, like, or it seemed little to me, and then same day they would happen. And so like I have no doubt that, people can say what they want or
Yeah.
whatever, but I know that like it was very comforting knowing that I wasn't like, he didn't just leave me there,
Yeah. Yeah.
But at the same time, I was also very frustrated at the whole situation in general, which really conflicted me because I was like, how can I be upset at what's happening and then like turn around and expect him to answer my prayers?
But actually, I think that's a very real thing. I think sometimes, like for us, when we're giving sermons and talks about like this is the posture you should have, and you should have faith in God, and I think when you're actually in the moment, you can have that, and you can also have feelings of, hey, this is terrible, and I hate this, and I want this to be away from me. I think both things can exist, at the same time, and I don't know that we give enough attention to that.
I feel like just from my thoughts prior, that almost seems contradicting. It's like, how could you have both?
But I feel like you understand it.
Now I do. It's like, okay, I get it.
Yeah.
But I still feel like there's some like resistance to either side of it because of the opposite feeling, Like I'm not 100% certain that it's right or that's how it should be.
Yeah.
Like in my head, it's like, unless it's all sunshine and rainbows, then it's not real, which now I know it's like, that's not how any relationship in life works. Or like,
sure.
So I feel like that's probably something that, I don't know. I feel like that's not something that's talked about a lot.
Yeah.
You're allowed to, be upset, but
I think we mention it, when we talk about David and King David and his like in his Psalms and how he's wrestling with God in his prayers and saying that God turned his face away from him. But I think we gloss over it because like, well, those aren't my feelings that I'm living in that moment. But when you're living it and feeling those things, I think you really relate with him. And it's like, yeah, actually I get that. I love him and I have faith in him, but I feel maybe at the same time neglected. I feel ignored. I feel confused. I feel like you said, like it's unfair. I think both things can be happening at the same time.
But should there be, because I feel like you can also kind of blow it out of proportion in a way, like to be upset about the littlest things. And I don't know, like what,
I think actually your story kind of highlights a lot of like the things that are quote unquote little. Like I remember when you were wanting to eat, okay? And they had to like do some sort of swallow test for you for you to eat. And actually for whatever reason, I think the lady wasn't there or she wasn't available or whatever. And we were waiting hours for this lady to come and make you eat a saltine cracker or something like that. And then you tried to eat it and actually you didn't do it. You failed whatever the test was.
Yeah.
And you were livid. Okay. Like you were livid. And from the outside looking in, or maybe for people listening, they're like, oh, it's a swallow test. Okay, he failed. I'm sure he's eating now. It is a small thing. But I think in that moment, it was the biggest thing in your life. What did you want? Was it applesauce? What was the food that you wanted him to give
juice.
You? Apple juice.
That's my favorite thing in the hospital. Yeah.
So, I don't think they were small things. And I think like those things are large. I think anything that is in that moment is the most important thing to us. Like if we think of God as our Father, when I think of like my children, when they ask for something, in that moment when they're asking for it, it is the most important thing in the world. They want that popsicle. There's these new shoes, whatever. It's the most, and then you as a father, you have perspective of like, well, it's just shoes.
Right.
But because of how important it is for him, I'll give it to him. So I think maybe that God looks at it maybe in that way towards us. He has, of course, a grander perspective than we have. But in that moment, I'm that child. Hey, I want some apple juice,
Yeah, that swallow test was... Did you hear about what happened the second time?
No, I don't remember.
Oh, man. Okay, so the first time it happened, I was so confident that I could pass.
And actually, you looked good that day. I was like, oh, he's going to pass this test.
I was so excited. And I remember she threw me off. It was like, here, take a sip of this. And they put like a camera. So this is the part that messed me up. They put like a camera in your nose that looks down your throat.
To make sure it's working.
Yes, so they could see, is it going down the right tube or whatever it is. And that was why I failed, is because I wasn't like, I wasn't able to differentiate like solids and liquids, or I wasn't clearing something correctly. And she's like, you're still at risk of
Aspiration.
yeah, aspiration. So we're gonna, and I was mad because again, they have to wait another week to do the test again.
Oh, they only do it once a week.
Yeah. So well, that's how they set it up, I guess.
Yeah.
And that tube that camera that goes in your nose, the first time it happened, like when they did it the first time, nothing was wrong. Like I did it, like didn't bother me. I was able to do everything. I just couldn't get the food down. And so then the second time when they came, I was like trying to hype myself up. I was like, okay, if I can pass this, I can eat, I can drink, whatever. And for some reason, this time around, the lady, when she put the camera in, I couldn't handle it. Like I started vomiting like multiple times throughout this test. Like she would give me a graham cracker, I would eat it, swallow it, and then vomit, and then like take whatever else and vomit. So in my head, I was like, "There's no way she's gonna pass me." I just vomited every time, and then apparently, like that was
okay.
It was okay that I was vomiting, and so I passed the test, and I was like, "This is so bizarre." Like I'm so
what kind of test is this?
I was so confused. But I remember before they were even giving me ice chips, talking about like most important thing at that time. There was a point in time when, I don't know, anyone who knows me knows I love In-N-Out. Like this is like, if
it's coming soon.
It's coming soon. I can't wait. But if there was one thing that I could have the rest of my life to eat and that was it, it would be In-N-Out. And there was a time when I was in the hospital, I was so thirsty and so wanted water, but they wouldn't give it to me.
I remember that.
They gave me ice chips instead. Like I was allowed to have ice chips. And I remember I would eat ice chips every second of every day. And I remember there was a point in time when like the ice chips were so good that if you had asked me like, what's better, these ice chips right now or In-N-Out, I would have said the ice chips. Like that's how much I wanted those. And then now that I'm better and eating regular stuff, I was like, man, I can't believe I almost gave up In-N-Out for ice. But yeah, it was bizarre. And so now everything is going. I guess I could talk about.
You still got more. There's more longer story.
Dang. So after I get out of the hospital and everything, now we have all the like after, like home care, and then dialysis. So my kidneys weren't working.
Which is, I think, a relatively normal complication of liver transplant.
Apparently, so it's normal for a short amount of time. Yeah. For normal
kidneys
patients
to stop working.
Yeah. I guess it's because the kidneys are like they said when the body experiences like trauma, the first things to shut down are the kidneys and something else, I think the liver. But obviously, so because I had 2 surgeries, my kidneys took, apparently I was on dialysis after the first surgery. Like they knew right away my kidneys were going to be shut down and I needed dialysis. But then I went to the second surgery and that took another hit on the kidneys. So now I'm like double, whammy. And then, so I was on continuous 24-hour dialysis in the hospital, and then they transitioned me to like the 3-hour or 4-hour treatments 3 times a week. And so for that, when I'm at home, I have to go to a dialysis center and sit there in a chair for 4 hours while they take my blood and clean it.
Yeah, and I remember you couldn't do it. Like you can't do anything. You're just sitting there.
I'm just sitting there, and I was like, this is torture.
And no one can come with you. You have to be by yourself.
Yeah, like the first time they let my sister come with me because we fought them. They were like, he can't be by himself. He has a drain that he needs to empty every hour, and like it was a big deal. And they were like, no, you can't come back. So they let her come back the first time, and then after that they're like, no, like you can't come back there. So I'm just by myself in this chair, and it made me. And
actually, you lost a lot of you haven't really, you didn't share as much you lost a lot of like muscle tone and like muscle ability. Like you were having a hard time like putting your hands up, like raising your hands maybe to your head, and like actually most of your motor skills were like, it took a long time to get back.
Yeah, I couldn't use my phone for the first month after I woke up because every time I would like my hand would just shake. And I remember what I forgot was how puffed up I got when I was in the hospital. I remember it like kind of briefly when I was going for a CT. I remember the bracelet that they put on you for like the hospital, like it was like hurting my hand. Like they put it on like
too tight.
Yeah, like
or you grew.
I grew, and my hand was like a bubble. Like it was just 2 bubbles. And I remember I was like, this is like something, what's going on? Like everything that seemed like it could go wrong went wrong. And my doctors actually told me that in like a follow-up. They're like, most people when they have liver transplants, like they'll have one thing go wrong or one connection that's problematic.
Yeah.
And then they told me, they're like, every single connection that you had a problem. And I was like, oh, okay. It was very funny, the things that they told me after.
When everything calmed down a little bit. Yeah, it wasn't so funny when it was happening.
I mean, it wasn't funny when they told me. There was one surgeon that kind of was like a little more in the background. Like he told me, he's like, if we would have opened up anyone else and saw what we saw in you, we would have closed them back up and not even tried.
Actually, many people told me that. Many physicians that I had spoken to after about your case was like, oh, no way that they should have, would not that they shouldn't have, but like that it would have been so high risk. But once they're in, they kind of have to, and you know.
They're like, if we would have known beforehand, we wouldn't have done it.
Yeah.
And I was like, well, that would have been nice to know. You know? Or the other one that was really funny was, we presented you. I guess they have like weekly teaching conferences.
Sure.
And my doctor told me, he's like, we presented your case at our weekly teaching conference, and everyone couldn't believe that you survived. I was like,
should I be happy? Yeah. Should I be like?
I was like, I mean, that's good, but
thanks.
like, really? So I mean, yeah, it's definitely a miracle that I'm still alive and able to do stuff. And like, yeah, I'm still very weak, and if you see me in person, like, I look half the size I was, but from now it's just trying to get better, I guess, trying to get more muscle and get back to my everyday life. And
well, trust me, we're all happy for you. We had, thousands of people praying for you, and it feels good to be back to our level of some normalcy here. Yeah. And that makes me feel really happy to be able to like give back to something that I know you love, and that's been helpful and enjoyable for a lot of people too. So we're glad to have you back.
Yeah. It was kind of weird. Like logging into all the socials and stuff and seeing people like endless comments of like praying for you and all this. I was like, wow. Like,
yeah, no, it was weird. It was very nice. It was very nice, very touching. I think, people really cared, and I think they really were praying for you. And I think that definitely made a difference.
There were a couple times when I was feeling really, really down. Then I went and like checked, and I was like, it like lifted my spirits.
That's amazing. Like, oh, that's awesome. No, that's good.
Yeah.
That's great.
So, I mean, hopefully this is
first of many more. We'll get back on a regular schedule. I remember when we started, what you said to me is like, we have to be consistent. We have to be regular if it's going to be good. So hopefully we had a small hiatus, but hopefully we'll get right back to getting regular and regular scheduled programming.
Yeah, I mean, after we post this one, should be every 2 weeks.
I hope so. I hope so.
We'll be back to normal.
All right.
Is that it?
I think so.
All right.